Okay, good day everyone. So I will be talking on factors affecting disclosure of HIV positive status among sexual partners in a secondary health facility in southwest Nigeria. As we all know, you might even know deficiency virus, which is HIV, is a virus that causes AIDS, and the epidemic is a major public health issue worldwide. And we are believing that since the introduction of this epidemic control to end up AIDS, that by 2020 it will be a no-go issue. The epidemic is public health issues worldwide, having claimed more than 39 million lives
Your
so
Miss
far.
Stellamaris, sorry for the interruption. Your voice is echoing.
It is. I complained before. I don't know why. I'm in my office.
No problem, Miss Stellamaris. If you have any doors or windows nearby, you just open it and start your presentation again because it creates disturbance to
Okay.
the audience.
Okay. I'll need to leave that place and go out. Hello? Is it still echoing?
Thank you so much, Mr. Stellamaris. Now you please proceed the presentation.
Okay, introduction. So, HIV is the virus that causes AIDS, and is still echoing. The epidemic is a major public health issue worldwide, having claimed more than 39 million lives so far. Nearly 37 million people were living with HIV in 2012, where sub-Saharan Africa is the most affected region, with women constituting 58% of all people living with HIV, as stated in the global statistics. 70% of all the people living with HIV are living in sub-Saharan Africa. UNA's 2014 global statistics. In Nigeria, the first case of HIV was reported in 1980, and since then, the estimate adult HIV and AIDS prevalence was 2.4%, with an estimate of 1.2 million people living with HIV and AIDS in 2010. In 2014, an estimated 3.4 million were living with HIV and AIDS, according to the global statistics, UNAIDS 2014. There are three major ways in which HIV virus can be transmitted: through unprotected sexual intercourse with an infected person, blood products, or from an infected pregnant woman to her infant, and in Sub-Saharan Africa. Sub-Saharan Africa. The predominant mode of transmission of HIV is heterosexual intercourse. Despite the same major mode of transmission, there is extraordinary difference in the spread of HIV among African countries for reasons that are complex, multiple, and poor documented. In general, the risks of HIV transmission depend on the effectivity of the index person, the type of sexual intercourse, and the susceptibility of the person thus exposed. So disclosure is being HIV positive is a difficult and yet an important decision for all infected people, which we know is very important, because when one discloses, the other partner will be able to, that is not infected, will be able to know how to care for he or herself or access treatment timely. However, it has also been identified to play a significant role in how individuals cope with their disease and adhere to treatment. While disclosure can have positive effects on an individual health, it also has the potential for negative effects, which are dependent upon the recipient response. On the other hand, Majority of individuals with HIV, disclosure is stressful. It may cause blame, discrimination, abandonment, stigma and loss of financial support, and disruptive of family relationship. For the fear of this risk, patients may not disclose their HIV positive status, rather than the relief that is anticipated when one discloses to others. They are often regrets. Regardless of the stress involved, the majority of the people with HIV do eventually disclose to others. Nevertheless, disclosure of HIV positive status has two sets of contrary effects. It may motivate partner for HIV testing and counseling. It may reduce transmission from mother to child. It may reduce risky behavior and increase accusation to support and adherence to AROTs. This study aimed to determine the prevalence of non-disclosure of HIV status among sexual partners and identify the factors associated with it. We all know that once one discloses, it gives an opportunity to have a treatment partner, somebody that can remind you of taking your drugs, and even when you are sick, they know where to take you to. So the materials that we use for the study the study was done at a general hospital, which is Rando General Hospital in Surulere, Lagos, local government area, Lagos State. And Rando is a government-owned secondary health center that offers antiretroviral services. Its study population consists of 150 clients who attend the ART clinic. 75 are ART clients. This source was gotten from the ART register as of 2015, December 2015. And 75 priority clients who are yet to be commenced treatment. That's a priority. And a descriptive cross-sectional study was conducted, and the sample size of the study was 50. A sample random sampling technique was used by using a slip of paper to randomly select the 50 clients. Identification of each of these clients was done by writing their names on slips of paper, and the data was collected using a pre-test structured interview administered questionnaire by two trained interviewers, that's the healthcare workers working with them. Verbal informed consent was obtained from each respondent and privacy ensured during the interview. The collected data were entered and analyzed using SPSS version 16. Descriptive statistics was used to describe the variables and to determine their relationship with the outcome variable. Odd ratio with 95% coefficient interval. So the results under the demographic, it was observed that 24% were male, while 76 were female percent participated in the study. Among the respondents, 20 had secondary school qualification, while 3 had higher diploma. So the next table is actually showing us the educational status of respondents. Those that responded right from PhD down to primary, and those that did not even go to school. So the number of clients that have disclosed their HIV status, the table 2 is showing us that the prevalence of non-disclosure is 40% among sexual partners in the study, and the percentage of clients that have disclosed their HIV status is 56. which shows that the level of disclosing one's HIV status is of the average. So also responded aggregated by sex, male and female. So table 3 is showing us the prevalence of male not disclosed his their HIV status, while the female is 44.7%. Although the table shows that the percentage of male who had disclosed their HIV status to partner is higher than that of female, but the number of male who disclose their status is 7, while that of female is 21. So the reason why they did not disclose is shown in the figure below. Some as a result of fear, they don't want to have divorce, they don't want to lose their job, stigma and others, why some did not respond at all. So the table is showing the percentage of people that did not disclose their HIV status. 14% fear of abandonment, 2% divorce, 1% loss of job, 12% as a result of stigma, 10% other reasons, while 60% did not respond. Responded disclosing, those that disclosed their results, their HIV status, so either their spouse or any other person. So in table 4 in the study shows that percentage of persons who responded had disclosed their HIV status to 30% disclosed to spouse, 6% to parents, 4% to spiritual leaders, 16% to others, while 40% did not respond. Clients who disclosed to partners in this analysis is higher. So responded reason for disclosing. The reason they disclosed was to one. The reason for disclosing is that so that they can they disclose to their brothers because it's their brothers. Some disclose to their husband because of their marriage, because they are HIV positive. 12% disclose because it's their husband.
Hello, Stella.
Yes.
Stellamaris. Sorry for the interruption. Try to complete your presentation within 2 or 3 minutes because your time is running. Okay.
Okay. So in conclusion,
You should Yeah.
I didn't send in my conclusion, but I can conclude with that. So the recommendation we got after is that based on the study and the level of disclosure being of the average, it is therefore recommended that HIV counseling should not be a one-off section. There should be an ongoing follow-up of counseling, and the importance of disclosure should be emphasized. Stereostatus disclosure reduced the risk of HIV transmission by 17.9% relative to non-disclosure, according to the study conducted in Gombe Specialist Hospital by Raymond in 2012. So therefore, it is recommended that counseling of HIV patients to disclose the HIV status should be continuous. Having unprotected sex with individuals who had not disclosed their HIV status should be discouraged. And the importance and benefit of disclosure of HIV stereostatus should always be emphasized. Then HIV positive patients who are yet to have treatment supporter should be encouraged to have one because of its importance. Couple counseling should be encouraged because it helps us to ease disclosure and HIV status. So in conclusion, the rate of HIV disclosure to their sexual partner was low. Spouse were the most preferential choice of persons HIV status were disclosed to. HIV status disclosure should be made soon after diagnosis because of its importance, especially to sexual partner. This encourages family support and reduce stigma. Thank you.